Kim Jong-un has told North Korea's COVID sufferers to gargle saltwater to treat the virus, according to state media, just hours after he chastised members of his cabinet and health officials for their poor handling of the pandemic. Last week brought the pariah state's first acknowledgment of an explosive COVID outbreak, with experts warning it could devastate a country with limited medical supplies and no vaccine program. More than 1 million people have been sickened by what Pyongyang is referring to as fever, state media said, despite Leader Kim ordering nationwide lockdowns in a bid to slow the spread of disease. Drugs procured by the state were not reaching people quickly or accurately, Kim told an emergency Politburo meeting on Sunday, before visiting pharmacies near the capital's Taedong River, state news agency KCNA said. The failure to distribute medicine properly was because officials of the cabinet and public health sector in charge of the supply have not rolled up their sleeves, not properly recognizing the present crisis, Kim said according to KCNA. Kim ordered immediate deployment of the powerful forces of the Army's Medical Corps to stabilize the supply of medicines in Pyongyang City, it added. Kim has put himself front and center of North Korea's disease response, overseeing near-daily emergency Politburo meetings on the outbreak, which he has said is causing great upheaval in the country. Although authorities had ordered distribution of national reserves of medicine, pharmacies were not well equipped to perform their functions smoothly, Kim was reported as saying. Among their shortcomings were a lack of adequate drug storage, salespeople unequipped with the proper sanitary clothing and hygiene in their surroundings falling short of standards, according to the pariah state's supreme leader. North Korea has one of the world's worst healthcare systems, with poorly equipped hospitals, few intensive care units, and no COVID treatment drugs or mass testing ability, experts say. While visiting a pharmacy, Kim Jong-un saw with his eyes the shortage of medicines in North Korea, Chung Sung-jang, researcher at the Sejong Institute told AFP. He may have guessed, but the situation may have been more serious than he had expected. South Korea's Unification Ministry, responsible for cross-border relations, said that it had proposed working-level talks to provide medical supplies, including vaccines, masks and test kits, as well as technical cooperation, but that the North had not received its message. The offer came shortly after South Korean President Yoon Suk-yeol said he would spare no effort to help the North fight its outbreak, saying it was ready to provide COVID vaccines and other medical support. Yoon said he would send humanitarian aid without political considerations, while expressing concerns over the North's recent missile launches and signs of preparations for what would be its first nuclear test since 2017. If North Korea responds, I would not save any necessary support for medicines including COVID vaccines, medical equipment and health personnel, he said in a speech to Parliament. North Korea's tally of the fever-stricken stood at 1,213,550, with 50 deaths by Sunday, after KCNA reported 392,920 more cases of fever, and 8 more deaths. It did not say how many suspected infections had tested positive for COVID. The North has blamed a large number of the deaths on people who were careless in taking drugs because of a lack of knowledge about the Omicron variant of coronavirus. Kim's public criticism of his officials' response to COVID is a sign that the situation on the ground is grim, said Yang Moo-jin, professor at the University of North Korean Studies in Seoul. He is pointing out the overall inadequacy of the quarantine system, he said. Kim has previously said the country will actively learn from China's pandemic management strategy, according to KCNA. China, the world's only major economy still maintaining a zero-COVID policy, is battling multiple Omicron outbreaks with lockdowns in some major cities, including financial hub Shanghai, sparking increasing public frustration. North Korea has previously turned down offers of COVID vaccines from China and the World Health Organization's COVAX scheme, but both Beijing and Seoul have issued fresh offers of aid since the outbreak was announced. North Korea is likely to need international assistance to get through the massive Omicron surge, Yang said. If China's assistance is not enough to overcome the outbreak, North Korea will ask the South, the United States or international organizations in the end, he said. U.S. President Joe Biden is set to visit Seoul later this week, with discussions of Pyongyang's weapons programs and COVID-19 outbreak likely to top the agenda. Despite the public health crisis, new satellite imagery indicates North Korea has resumed construction at a long-dormant nuclear reactor. The United States and South Korea have warned that Kim is preparing to conduct another nuclear test, the regime's seventh. Analysts have warned Kim could speed up testing plans to distract the population from the disastrous coronavirus outbreak. Taking pandemic help from South Korea would both hurt North Korea's ego and force it to hold off on its nuclear testing plans, said researcher Chung. If Kim Jong-un is determined to conduct a test, he will not accept South Korea's help, he said.